Hello everyone, this is Dr. Jerry Cowart. Today we're going to be talking about sciatica and leg pain. So if you, like many people out there right now, who have been working from home a lot more lately and are starting to get out and exercise more and walk and run and jog and bike and all those things, and now you start to have some pain in the buttock or pain in the leg and you don't know where it's coming from, this lecture is probably for you. Alright, so in today's lecture, we're going to start out with talking about some statistics, who all is affected by sciatica. And then we're going to talk about, what is sciatica and then also what is not sciatica. Then we're going to talk about anatomy, some basic structures involving sciatica and the sciatic nerve, so that way you can have more complete and educated conversations with your healthcare professionals. And then we want to talk about some conditions that can cause sciatica, and then some other conditions that are not as common, or rather not as thought about on the first glance when we're dealing with sciatica. And then we're going to talk about some, basic nutrition, things that you can take that can help with it, or some nutritional deficiencies that could be contributing to sciatica. And then, always my favorite part of the lecture, which would be, the different treatments for it. How do we fix it? Okay, so when we're dealing with sciatica, it's that about 40% of the population at some point will experience sciatica. And that's actually kind of a big number when you think about, the last bullet here where it says 10 to 15% of people with low back pain will experience sciatica with the low back pain, which just goes to show you how many people actually experience low back pain in their life. 40% of that, and then you have 10 to 15 people with low back pain who are experiencing sciatica. That's actually a huge number. And at some point, there was a male prevalence to sciatica, which I think has decreased over time since people are more educated about wallet uses. A lot of males used to at least put their wallet in their back pocket and not take it out when they would sit. Well, they're basically sitting on a giant brick, because if your wallet ever looked like what mine used to look like or what my father's looked like, it's just a giant filing cabinet that you have in your back pocket. Nowadays, I think guys are more aware and more smart on the damaging factors that can have. So people aren't sitting on their wallet as much. So that's why I think the literature doesn't support a male to female prevalence anymore with that. And then it does show that age can be a contributing factor, mainly due to more of a spinal degeneration nature that sciatica often has. But, sciatica isn't limited to the older population. I've seen, kids as young as, 9, 15 or so years old with sciatica pain because, kids are starting to get into sports a lot earlier in life nowadays because they're trying to be more athletic, more competitive. And trauma can easily be a contributing factor to sciatica too. So it doesn't have much of an age discrimination anymore either. But it typically does happen older age and male, but those numbers are definitely shifting. Definitely if we're overweight, that's going to increase the likelihood of sciatica because you are adding more axial force onto the spine. And then, we also talked about the fact 10 to 15% of people with low back pain will experience sciatica at some point while dealing with that low back pain. So next we're going to talk about, what is it? And we talked about how many people can be affected by it, but how do you know if you're one of them? So sciatica is defined as pain along the sciatic nerve. So that does go the difference between what is it and what it's not. A lot of people will mix the word sciatica and sciatic nerve as one thing. You have a sciatic nerve, and sciatic can be pain along that sciatic nerve or some sort of issue with that sciatic nerve. So sciatica is pain along the sciatic nerve distribution area, which would be within the low back, the gluteal area, so that buttock region, and the posterior thigh. So that's, the back of your thigh there. And then sometimes, because the way the nerve will branch into smaller nerves, you can also get pain going down that back of the leg, the calf muscle, or sometimes the outside of the calf muscle. And you can also get pain or burning or weakness into the feet as well. As we'll see here shortly, it has a lot of associated conditions that can overlap with sciatica. You can have multiple things that are all relating to sciatica, or you can have one big thing that can mimic a whole bunch of other things. And then it's usually unilateral. Unilateral meaning one side of your body, one leg. So sometimes you can, and it's rare, you can get sciatica in both legs at the same time. And we'll discuss, a little bit further about how someone can have it at the same time on both legs, but typically it's only going to be in one leg. So now would be a good time to discuss how sciatica can be caused in someone, and really how anything can be caused in the body. And we're going to talk about what's called the triad of health and the 5 factors. So this triad of health is that triangle that you see in the middle there. And it basically states that when anything is wrong in the body, whether it be sciatica or big toe pain or cardiovascular disease or whatever the case may be, there's really only 3 things in life that can cause anything to happen in the body. And the first part of it is the structural piece. That's the part at the bottom. So when we're looking at structural piece, that's anything that you can physically see and touch with the body. So that is your anatomy, that's bones, nerves, muscles, anything like that. And we see that the structural component can have a negative effect by any kind of trauma or injury. So that's your macro traumas, that's your micro traumas. Macro traumas being like an automobile accident, breaking a bone. I use the joke, falling out of the airplane or kicked by a horse, any of those kind of deals. Your micro injuries, however, are like, say you have the wrong mattress or the wrong pillow height for you and you're constantly sleeping on that all night, every night. Or say your ergonomics at work or nowadays at home isn't appropriate for you, so you're constantly having to like turn your head or crank your neck to be able to see your computer monitor. Those will all be micro traumas. And then secondly, you have the chemical component. We consider this as anything exogenous outside of the body affecting the inside of the body. So maybe it is nutritional deficiencies, like you're not getting enough of nutrients that you need, or maybe you're getting too many of something, too much of something that is also negatively affecting you, such as like toxic metals, or you're constantly eating GMO processed foods, or whatever the case may be. And then lastly is emotional. So this is how you perceive your overall world. It's how the mind works. It's how you perceive your stressors in life. We always have that example of, say you're at work and you've got a boss that just really annoys you. You don't have a great boss and you get super stressed out, and now your shoulders are super tight and stressed because that's where you quote unquote carry your stress. That would be like an emotional component, having to deal with the work dynamics, or maybe it's home dynamics, maybe it's like not a good relationship, or there's deaths in the family, whatever the case may be. We're in that time right now where it's a very stressful global environment, and so we see a lot more emotional pieces are coming out in patients with this. And so those are that triad of health, and we see that triad of health can be affected, if you will, by 5 main factors. So if you look at the top, the N means nerve. So this is mainly where chiropractors lie. So your nervous system controls everything in your body. And you've got your central nervous system being your brain and your spinal cord. And then you've got nerves that branch off of that to your peripheral nervous system. So things going into like your arms, your legs, different organ systems, things of that nature. So if your nervous system isn't firing properly, you'll have a breakdown with anything else in the body. And the next two is the next one will be neurolymphatic. So that is how your lymphatic drainage happens. So it's any kind of toxic buildup that isn't able to drain out of the body. and you're not able to remove the waste out of your body as properly. The third one there is your neurovascular. So that is your blood. That's your river of life. That's what transports all the nutrients and oxygen that you need to different target organs and muscles. And if you don't have the good quality nutrients and things in your blood to transport, then it can kind of be a cesspool in a sense. So we're seeing here, with the use of masks, people aren't getting enough oxygen, and so therefore there's a lot more CO2 in the blood. So we're starting to get a huge buildup of CO2 and lack of oxygen. So that can be one example how the neurovascular component of this can be a huge contributing factor in this current climate, if you will. Next, you have the cerebral spinal fluid. That is basically like your lymphatics in your blood, but for your nervous system. So it completely bathes your nervous system and gives the proper nutrients that it needs, and also takes out any of the waste that it no longer needs. If you've got the flow pumps basically from your cranial bones, and more importantly, what we're talking about today, your hip, pelvis, sacral area. And if those are misaligned and not able to move like they're supposed to, that cerebral spinal fluid can get stagnant. And then lastly is your AMC, your acupuncture meridian connection. That's basically the harmony of your body. That's how everything in your body is connected and works together. And so if you have different organ tissues or different muscles and things of that nature that aren't working in harmony together, a lot of times this is your acupuncture meridian connection that is struggling, that just needs support with that. All right, so as we started with the previous slide, the structural piece really is where a lot of chiropractors kind of lie and get a lot of bang for their buck, so to speak. So when we want to look at the structural component of the whole sciatic nerve area, so to speak, so that way you guys are understanding, what part of the body are we talking about here and what parts of the body are being affected if we're dealing with sciatica. So we'll start here with the picture on the left. Your sciatic nerve, as you can see towards the bottom, is a giant nerve. It's about the size of one of those old school thick yellow highlighters. And the reason why it's so thick is because it actually is two smaller nerves coming together into one giant nerve bundle that will later on branch. And so those two nerves that come together to make the sciatic nerve all originate from that low back, that lumbar spine, and that sacral area, and sacrum being that small triangular bone at the base of your spine. So we see here you have L4, L5, which stands for lumbar 4 and lumbar 5, which is just the last two vertebrae of your spine, of that lower part of your spine. And then S1, S2, S3, S meaning sacrum. So those are the first three nerves that come out of that sacral bone. So if you look at all five of those nerves, they come together to create one big old nerve known as your sciatic nerve. Okay? So if you look over at the next picture here, you can see a better idea of that whole, what we call that sciatic nerve distribution area, so to speak, like what we talked about before. So you can see where, if you look really close, there's small nerves that are coming from the low back and sacrum, and they come together and form that sciatic nerve. And then as you follow it down, you start to see where it branches and it branches and it branches and it branches. If you go down to about where like the knee is located, you can see where it really branches off into two main nerves, your tibial nerve and your deep peroneal. So this is why when we were first defining sciatica, is that pain distribution along the sciatic nerve that can go from the low back, the gluteal region, down the back of the leg, and sometimes it can go into that calf area and into the feet. Well, this is why we say sometimes, because really that sciatic nerve stops at about the level of the knee, and then that's when it branches. Now, with that nerve being so big, and if there's any kind of damage or compromise or compression or anything like that going to that sciatic nerve, it's kind of like a river. Anything can happen downstream. So there can be an issue with any of those branches, like the tibial nerve or the peroneal nerve, that will give rise to any kind of pain, burning, numbness, weakness into the calf area or in the foot. So after seeing all the different branches, if you will, of that sciatic nerve, it's kind of no surprise that there's many different conditions that can be associated with sciatica that can bring on that sciatica-like pain distribution. So the first one we'll talk about is DDD, DJD, OA. So DDD is degenerative disc disease, DJD is degenerative joint disease, and OA is osteoarthritis, which is basically degenerative joint disease. They're basically AKAs. So basically the whole name of the game on that first one is degeneration. It's the degenerative processes in the body. And then we'll also talk about trauma. We'll actually kind of talk about them together because you kind of can't not talk about them together, so to speak. And then we're going to talk about Piriformis Syndrome. And then obviously we're chiropractors, so we're going to touch base on subluxations and that low back and sacrum. And then also we're going to talk about ligament instability. And spoiler alert, this one's kind of a huge one, especially in today's world with everything that's going on. So first up, we're going to talk about degeneration and trauma. And quite frankly, this is probably the biggest reason why someone would have sciatica is everything that is on this particular slide. So initially, we talked about disc, we talked about the degeneration of the joints, and we talked about overall degeneration and trauma, okay? So first we're going to talk about disc, and there's a couple of different reasons why a disc would be involved. One of which would be an actual degeneration of the disc, and the second part of it would be a herniation of a disc, okay? So if we look all the way to the right-hand side, the white picture that says healthy disc, degenerated disc. The reason why we can have sciatica with a degeneration of a disc is if you look at the bone that says healthy disc. It's a nice healthy bone. If you look at the disc above it, you can see the striations where everything is intact. It's got good height to it. Everything looks great. And if you see directly to the right of that, those holes where the nerves come out of, those holes are called foramen. You can see that there is some extra space in there. So everything is intact. Everything is able to pass out of that hole, out of that foramen like it needs to, that spinal nerve. So that's kind of like when we're talking about pinched nerves in a sense. But as you progress down this spine, and by the way, this picture is showing lumbar spine, just the anatomy that they're using. So it's actually very applicable to what we're talking about. This is actually part of your lumbar spine. So if you progress down this spine, you start to see that the disc height is starting to get smaller and smaller and smaller to the point where you barely have a disc at all. That's the degenerative disc. And as you look to slightly to the right where all the nerves are coming out of, as you go down the spine, you start seeing that that foramen is smaller and smaller and smaller as you go down the spine. That's because you don't have that disc anymore that provides the height, which provides more opening, more space in that foramen for that nerve to come out of, which in turn can give you that, quote, pinched nerve type sensation, which in turn can damage that nerve and give you the sciatica, can give you that pain, the burning, sensation, and give you the weakness in the muscles. And truth be said with the degenerative disc can also be said for the degenerative joint disease or OA. If you're having discs that are degenerating, almost always you're going to have the joints around it that will also be degenerating, which in turn will also give rise to that narrowing of that hole, of that foramen, which again just gives you that whole perfect storm to impair that spinal nerve that gives rise to the sciatic nerve. So that's with the degeneration of the disc. So if you look in the middle picture here, it talks about more of a herniated disc, and it really acts the same way. So a herniation of the disc is basically the middle center of the disc. It's basically like Imagine like a jelly-filled donut. Obviously, we don't condone donuts at Roselle Center for Healing, but people understand what a jelly-filled donut's like. So the outer portion of the disc is like that more firm donut part. And then the inner part of the disc is really like a fluid that's very similar to like toothpaste. And it acts as kind of like the jelly in that jelly-filled donut. So if you were to, squish that donut, so to speak, you would get all that jelly gushing out of the side of that disc, right? Because you just put a huge axial force onto it and it made it squish out because the outer part of it was not strong enough to be able to contain that fluid. That's what happens to a herniation. That jelly center of the donut coming outside of the donut, that's a herniation. So if you look at this center picture here, right in the middle of the cartoon vertebra, it will show the herniation. You can see where part of that disc is going backwards, affecting that nerve, okay? It does the same thing as if that foramen, that hole, would be compressing that nerve, but instead of the foramen or the hole getting smaller, compressing the nerve, the disc is basically infringing on its space. It's kind of moving in close, invading its personal bubble, if you will, and impinging and inflicting damage onto that nerve. Again, giving rise to that sciatica pattern. Now, this is when we talk about why someone can have sciatica on both legs versus just one. Typically, you only get sciatica on one side of the leg, especially when we're dealing with a disc, because the most common ways that a disc can herniate is out through the sides. So if it goes out through, say, the right-hand side, then you will probably end up having sciatica on your right leg. Conversely, if the herniation happens on the left side of that disc, it can potentially affect the left leg and creating sciatica on that left leg. The reason for that is because you have a really, really strong ligament that runs along the back of the spine that helps keep the disc where they're supposed to be. So if there's a herniation coming out, it almost always cannot come straight backwards because you have that strong ligament protecting it from that. So it almost always goes to the right or to the left. Now, if for some reason we have ligament instability or ligament damage, or the trauma is so great that it damages that ligament, you then in turn can have a disc herniation that is central. So if you heard of a central or a centrally located herniated disc, that's what can happen. And because those nerves run right along that center of the spine before they exit out of those foramen on each side, that is when you can end up having both, because that disc will affect the whole spinal cord. It will affect both sides of that nerve before it even exits out and goes and forms into the sciatic nerve. So that's one of the reasons why you can have both legs, but it's almost always not going to happen that way. It's pretty rare that it will. We talked about the vertebra degeneration. IVF, that is the other name for that hole or that foramen that I talked about. IVF stands for intervertebral foramen, meaning the hole that is, or foramen that is in between each vertebra. And then you have spondylolisthesis. So this is another trauma-related thing, which also can be degeneration as well. So the spondylolisthesis, if you look at the x-ray picture here and you see where the arrow is pointing to, you can see that you have that dotted line that is nice and curved and straight and it looks super pretty. And then you get to where the arrow is pointing to, and then you see where that dotted line breaks and goes off and does its own thing. Well, that's because you have that vertebrae that just moved completely forward. There's a few different ways that can happen. One of the main reasons would be trauma. So if you're playing football and you get hit super hard, or an automobile accident can happen, or you've fallen off a horse, any kind of major trauma can break part of that spine, causing instability and then therefore causing the spine to shift forward. But you also have degeneration that can do it. If you have degeneration, the bone itself changes shape, which in turn can shift the lining of the spine, which oftentimes can make the bone shift forward. If the bones shift forward like that, it does the same thing that we talked about before. It changes the shape of that foramen, of that hole. If you change the shape of the hole of that foramen, it almost always is going to change it for the worse, meaning it gets smaller, which in turn impinges and inhibits that spinal nerve coming out, giving rise to the sciatic nerve, giving you that pain, that burning, that numbness, that weakness down that sciatic distribution area. So all these things, and that's why I lump degeneration trauma together, because you really can't talk about one without the other, because it's all really the same anatomy. It's just what's happening to that anatomy that's causing that pain patterns. So another common reason why sciatica can exist with someone is a phenomenon called the Piriformis Syndrome. Now, the piriformis is a triangular band-like muscle that you see below that starts at the front part of that sacrum, that triangle bone that we talked about, and it attaches to what's called the greater tuberosity. So that is that outer portion of that femur bone that you see there. The issue with piriformis syndrome is that oftentimes it's thought about that muscle being tight, therefore constricting that sciatic nerve. But sometimes it can also be where the piriformis muscle is not working properly, so it gets flaccid or it gets flimsy, and it basically just kind of lays on that sciatic nerve because there is no tonicity. It's not taut enough to be able to activate and do what it needs to do and get out of the sciatic nerve's way. So it is oftentimes the throughout the examination of, okay, is it overly contracted? Like, does it need to be stretched out? Does other muscles need to be activated to alleviate that piriformis muscle? Or is that piriformis muscle not working properly and we need to be able to upregulate it and start activating it and get it to work properly to get out of the sciatic nerve's way so that the sciatic nerve can start doing what it needs to do? So a lot of times when you have that sharp pain in the buttock region that comes along with that sciatica, we talked about how that is one of the symptoms of sciatica, is that sharp pain or burning sensation in the buttock area. A lot of times it's due to this piriformis muscle, and oftentimes it is because it's contracted. It is the spasm, if you will. And so a lot of times it's trigger points. You go in and you relieve that piriformis muscle, and then a lot of your sciatic nerve pain will start to eliminate fairly quickly because of it. Now, if you see here, I have 3 different pictures here, all basically the same thing with a slight difference. So the one on the very left is normal. You have your piriformis muscle, you have that sciatic nerve coming out of the lumbar spine in your sacrum, exiting out, going underneath that piriformis and going down the leg. That's normal, that's what it's supposed to do, everything's good to go as long as the piriformis is behaving, right? So the second one here and the third one are what are called anatomical variants, meaning it's normal, kind of. So it happens normally with the growth and development of your anatomy, but it isn't the most common. It isn't super normal. And there can be complications with this. So earlier when I was talking about the anatomy, I alluded to how the lumbar spine and the sacral nerves, those spinal nerves form 2 small nerves that will in turn create that sciatic nerve and then have that sciatic nerve go down the leg. Well, in this middle picture here, you actually see where one part of that sciatic nerve goes through the piriformis and the other part goes underneath it like it's supposed to, and then they both eventually form that sciatic nerve. That way is a little less common than the first normal way where it just goes straight underneath the piriformis. So if that muscle is contracted, you can start getting issues with parts of the sciatic nerve. And as we see, or as we've seen before, that sciatic nerve goes to a lot of different places within that leg. So you would get very specific sciatic nerve distribution pain and weakness with this particular presentation. And sometimes it can be more difficult to treat because you have to make sure that that muscle is working absolutely 100% perfectly, or else it's going to continue to cause issues with part of that sciatic nerve. And as you go to this third picture here, the one all the way to the right, this happens in about 12% of the population. And that is the entire sciatic nerve goes through that piriformis muscle. It is very frustrating. And oftentimes you won't know that this is the case until you have someone who's got sciatica and you've done x-rays and you look and their spine looks absolutely fantastic and they are coming in with that sharp pain in the buttock area, and you know that the piriformis is involved and you're doing everything you're supposed to and the patient's not getting better. And then you end up having to go get like a CT or MRI to look at the actual soft tissue. And that's when you see that that sciatic nerve comes right through that muscle. And it's funny, when I was actually still in the clinic system in school, I actually had a patient that had a known diagnosis of that sciatic nerve going through the piriformis muscle. So that individual was part of that 12%. So I had to treat him a little bit differently. But the main goal with that particular patient is making sure that the piriformis muscle is operating on all four cylinders. It is doing exactly what it needs to do. There is no hindrance from other muscles not doing their part, and making sure the entire pelvis sacral area is intact and doing spectacular. That's the biggest thing with those individuals. And it's definitely not a life sentence. You can definitely get, alleviation of pain or 100% pain reduction with these individuals. Just those individuals may need more long-term maintenance care just to make sure that it doesn't come back. I put gonads on here because for those of you who are not new to Roselle Center for Healing, at this point you're well aware that within applied kinesiology, we're studying a lot of muscles and muscle functions, and we see that a lot of different muscles relate to organ functions as well. Well, with the piriformis, we know that the piriformis muscle relates to gonads or reproductive sexual organs. And so we see that if we're in the facet of the piriformis muscle being flaccid or inhibited or not working properly, it's likely that that muscle is not working properly due to maybe organ function. So this is why, like if it's male, it could be, someone with prostate issues, or if it's female, it could be someone who's got their ovulation hormones that are just not working properly. And either one of those two individuals can easily have sciatica, can have that sciatic pain, have that deep boring pain in or deep sharp pain in the buttock area, having the burning down the leg weakness, feet weakness, things of that nature, because of that relationship to the gonads. So another reason, and a pretty common reason why someone can get sciatica, is due to subluxation. And so we brought back the triad of health and the 5 factors diagram here, because when we're looking at the triad of health and the 5 factors, really the triad of health, any disruption in any one of those sides of the triangle or a combination of the 3 can cause a subluxation. Now, what is a subluxation? Here's a good basic definition of a subluxation. It says a small misalignment of a spinal segment or a vertebra causing irritation to a nerve, resulting in a loss of normal function. I like the definition of a subluxation to be more broad than just a spinal segment or a vertebra, because you have nerves that go all throughout the body. And you can have a subluxation at any joint in the body, because a lot of your nerves go through and around joints. So you can have a subluxation in your lumbar spine, as shown by this diagram. You can have a subluxation in your upper neck. You can have a subluxation in your wrist. You can have a subluxation at your knee. Anywhere that there's a joint, there can be a subluxation if this triad of health is not in balance, if those 5 factors are not in balance. So that's ultimately how a subluxation occurs in the body. That's how someone gets a subluxation in the body, is because one or more of these 5 factors or triad of health is not in balance and not in sync with the others. That will cause that small misalignment at any joint, much less the spinal levels having a misalignment. And again, we talked about, when we were talking about the anatomy of degeneration and disc, if you have a misalignment at a joint, or even the joints in the spine, that too would cause a narrowing of that foramen that we talked about, giving an aberrant information going out of that nerve function, as we talked about here, a loss of normal nerve function. Again, giving that pain, that burning, the numbness, the weakness, i.e. sciatica. Something to mention, I talked about outside of the spine subluxations like the wrist and the knee and things of that nature. If you remember back on when we talked about the anatomy and how that sciatic nerve branches basically at that knee, if you have a subluxation at the knee, specifically in the fibula, that can also give you a lot of that burning, that pain, that numbness, that weakness into that calf muscle and into the feet. That oftentimes gets overlooked when we're looking at sciatica, because most of the time when someone has sciatica, the practitioner is only looking at the lumbar spine or the sacrum or the piriformis muscle, but oftentimes forget about, well, what's going on at the knee? Do you have the leg weakness? Do you have the feet weakness? Do you have that burning sensation? Well, you've been working on this over and over and over again. Well, what about looking at that knee? Is there a subluxation there at that fibula? Is there a subluxation going on into the feet? There is something to be said about the foundation principle. If you have subluxations in your feet, you don't have that good foundation at the feet. Anything up will also not have proper foundation and proper structure, and can also be subluxated and having that loss of normal nerve function as well. So subluxations are super huge, super key in treating just about anything in the body, no matter what you've got going on, whether it's sciatica or depression or big toe pain or whatever the case is. Subluxations are always key, always important to look at and to correct when founded. So lastly, of the most obvious conditions that can be affected with sciatica, we're going to talk about ligament instability. And unfortunately, this is one that is a lot more common in the current global climate right now. Because as you can see here, we're talking about traumas, micro and macro traumas, as we discussed before, stress, and nutrition. So the micro traumas are the biggest thing with the current climate, because everyone's working from home right now. So a lot of people, if they had proper work ergonomics in their office, which some of them still didn't, and then they moved to working from home, they definitely don't have proper work ergonomics at home, because I've heard a lot of stories of people of, well, I don't have my desk anymore, I'm just working from the kitchen table now, or I'm working from the couch, or I'm working from my bed. Those aren't proper work ergonomics. So those would all be micro traumas. And then you have stress. We've got the whole global pandemic. You've got currently the riots that are happening. There's a lot of overall stress that's being had on people that are just weighing them down. And when we're dealing with stress, that's going to affect your adrenal glands. Adrenal glands are your stress glands that sit right on top of your kidneys that produce your hormone cortisol. Cortisol is your stress hormone. Basically, long story short on that is that with increased stress, with increased adrenal fatigue and adrenal stressors, will break down and make your ligaments way less stable. And then obviously there's some nutritional components to maintaining proper stability within the ligaments. And of course, when you're stressed, who stress eats apples and bananas? Everyone is stress eating like chips and milkshakes, and no one stress eats good stuff. So a lot of people aren't getting proper nutrition that they need to help maintain proper ligament stability. So you basically have this whole perfect storm here that leads to your ligaments not staying strong and keeping everything intact. So I really love these two pictures that I put here, because it just shows the complex web that it takes to keep the sacrum, the low back, lumbar spine, and that hip all connected and contained and stable together. There's a lot of different ligaments that you can see here. And what I like to point out is on this top picture here, the giant white band that you see running along the spine part, that was that central ligament that I was talking about earlier when we were talking about disc herniations, that basically prevents the herniation from coming centrally and forces it to go to the right or to the left. So that way you have a better visual for those who are visual learners, a little bit of what I was talking about previously with those disc things. But yeah, you've got a lot of ligaments here that keeps the whole sacroiliac, lumbar sacral complex together. And if one or more of those ligaments aren't stable, you can see where you'll just have a breakdown on all of that, which in turn will just cause that derangement in that sciatic nerve, giving rise to sciatica. Okay, so other conditions that people don't necessarily associate with the low back, the sacral area, or sciatic nerve or sciatica are things like the upper cervical, cervical meaning neck. So we're talking about the upper portion of your neck. TMJ, that's your temporal mandibular joint, so we're talking about the jaw. ICV is your ileocecal valve. It's that valve that connects your large and small intestine together. And then obviously obesity and diabetes. So the first of these other quote-unquote conditions dealing with sciatica is upper cervical involvement, upper neck involvement. So there's two main reasons why the upper cervical can be involved with sciatic pain. First one being the Levitt brother connection or Levitt brother association, and then dural attachments. So when we're talking about the Levitt connection, the Levitt brother connection, it's what this picture is showing. So we see the Levitt brothers, each brother is the equal and opposite part of the spine that relates to each other, that works very similar together, that moves in a very similar fashion while walking in a gait mechanism. So we see that C1, that is that atlas, that is that top vertebra, that is a very top bone of your spine, relates to the very bottom of your spine, being that L5 bone that we talked about. And then as you see, as you keep going inward and inward towards the spine, each one of the equal and opposite bones relate to each other. Furthermore, we see that that sacrum bone, that triangular bone at the base of the spine that we've been talking about this whole lecture, relates to the occiput. Occiput is that bone that is part of the skull. It's the base of the skull that attaches the skull to the top of the spine. So when we're looking at anything upper cervical, we can never ignore that occiput because it is basically that huge window between your central nervous system, that brain, the brain stem that goes into that spinal cord, and it connects the top part of the central nervous system, being the brain, and that skull complex to the rest of the spine. And speaking of the neurology of that, we have dural attachments. So dura is basically like, if you want to think about it, it's kind of like a saran wrap wrapper around your central nervous system, around the brain, around the spinal cord. And within that spinal cord that goes throughout the spine, at certain parts throughout the spine, that dura, that saran wrap wrapper, has different small attachments that it will attach itself to the physical vertebra itself. The main attachments of that dura onto the bones is in the upper cervical area, that C1, C2 area, and the low lumbar spine, the low back area. And if we have a subluxation or a trauma or degeneration, anything that would cause those bones to get misaligned or rotated or turned or any which way can be misaligned, it will physically pull and tug on that spinal cord, on those nerves, and therefore will also pull and tug on the opposite end where it's also attached. So that's why a lot of times upper cervical involvement can be involved when we're dealing with anything in the low back area, and in this case we're talking about sciatica in this regard. So next, I think it's important to talk about the TMJ, the temporal mandibular joint. Basically, we're talking about the jaw here. The reason why I think it's important to talk about this right now is that we just got done talking about the Levitt brother connection between the upper part of the neck and the lumbar spine, and then also that sacrum and occiput. Well, if we look even further past the sacrum and we look at the other part of that SI joint, that sacroiliac joint, we have the ilium. That's your hip bones. The Levitt brother connection to the ilium, or those hip bones, is that jaw. So the Levitt connection to that SI joint would be your TMJ, your temporomandibular joint. So as you're walking, talking, moving, grooving, we see that those joints, those bones will move very similarly together. And another part to look at is a lot of, you can, if you guys were here with me and I say, raise your hand at how many people you know have TMJ issues or TMJ disorder, a good portion of you would probably raise your hand. A lot of people do suffer with jaw dysfunction of some kind. And if you see on this right-hand side picture, there's a lot of different things to consider when you're looking at the jaw, and this is only really a small portion of the different issues that can arise when looking at TMJ. So we see that there's a few different muscles going on that all have to be intact in order to have your jaw moving freely and properly like it's supposed to. But a big issue is what's called vertical dimension. So if you ever get like crowns put in or a root canal or any kind of dental work that is being done, you got to make sure that you're going to a dentist who really knows and understands vertical dimension, because if those vertical dimensions, meaning how your teeth align together from top and bottom, if those vertical dimensions are off, that is going to shift your entire jaw. And as we talked about before with degeneration and subluxations, just the smallest misalignments in any joint, and oh, by the way, teeth going into your jaw is also a joint, just throwing that out there. Any kind of small misalignment at any joint can have a huge deteriorative effect on the rest of the body. As we saw, things that are happening, within the skull and the upper part of the neck have a huge effect on what can happen in the low back and the sciatic nerve, giving rise to sciatica. So we want to make sure that any kind of dental work that you end up needing to have gives you the proper vertical dimensions. And sometimes it's good to go get evaluated by a dentist or an orthodontist who can specialize in the vertical dimensions of the teeth, just to make sure that they are properly aligned in that manner. It can be the big missing piece in dealing with something like sciatica for sure. All right, so we've come to the point in the lecture where we're talking about gut health. And honestly, if you've been around Roselle Center for Healing long enough and you've seen multiples of these online webinars or our in-house lectures, I don't know if there's ever been one where at some point we did not talk about gut health to some effect. Gut health is super important no matter what type of issue we are dealing with within the body, and sciatica is no different. So we're going to talk about specifically the lleocecal valve. Like I said before, that lleocecal valve is that valve that combines your large and small intestine together. And during normal bowel movements, as your fecal matter, the food processing, things of that nature, is moving throughout your intestinal tract, that ileocecal valve is supposed to open or close depending on when things are moving through it. The problem occurs is when it gets stuck open or closed. Now, it can get stuck open or closed depending on a few different things. The main common reason would be if you're constantly eating foods that doesn't agree with you, meaning foods that you are allergic to or sensitive to, that can irritate that lining of your gut, and therefore it can irritate that valve, which will put it into spasm. It can make it either get stuck open or stuck closed. Neither one is good because you want that balance between opening and closing. So when those valves get stuck open or get stuck closed, you can get what's called fluid ingestion. Basically, because you're not able to move and eliminate the fecal matter and the waste out as efficiently and as effectively as you're supposed to, your body will start retaining that toxic fluid. One of the main sites that body will start to retain that toxic fluid is within your lumbar discs. We talked about earlier how the discs are fluid filled, that toothpaste-like fluid. We talked about how it's kind of like a jelly donut. Basically what happens is that toxic fluid gets retained within those discs, basically making that jelly donut extra stuffed or mega stuffed, if you will. That in of itself, even though you don't have that full-on herniation with that fluid coming out of the disc, you're basically swelling that disc so much that the outside portion of that disc is acting like a herniation, still applying pressure and irritating that lumbar spinal nerve, again, causing issues like sciatica. So we want to make sure that we're giving the patients proper gut health, that we're eating right, we're eliminating any of the foods that you're sensitive to, so that way we are decreasing the irritation and inflammation to that valve and to the rest of the gut. So that way we're preventing that fluid ingestion, that toxic buildup in the disc that we're talking about. And also on the side note, a lot of the nerves that come out of the lumbar spine and the sacrum also innervate portions of the large intestine and small intestine. So again, it goes back to that subluxation base. We want to make sure that those nerves are not being impeded. So that way, one, you don't have sciatica. Two, you have proper movement and ability of those intestinal tract as well. So it's kind of like everything feeds off of each other. You can't work on one without affecting the other. All right, and lastly, I just want to touch base on this because we did talk about it briefly before, obesity and diabetes. So obesity is just going to add more physical force on the spine. So we talked about how the discs protect your spine from the axial gravitational forces of the spine. It's like a shock absorber. And when you add obesity to an extra pound, that becomes extra force onto the spine. It basically just makes you even more susceptible to your disc herniations and your degeneration, because it's just extra force that spine was not originally built to be able to handle. And that actually does also go the opposite effect with like professional bodybuilders. That's also a whole lot of extra force that the spine is having to carry around. But we're mainly talking about obesity here, because also when someone who is obese, they have a much higher prevalence of getting diabetes, especially for those who are obese in the truncal area, like the stomach area, the mid-trunk. That is a huge contributing factor that can cause diabetes. And one of the things with diabetes, we know that it can cause nerve damage. So when we're dealing with sciatica, a lot of it is being nerve damage and causing the pain, the inflammation, the burning, the weakness. And if we're adding diabetes on top of that, you're just basically adding fire to more fire. You're just lighting that fire even more. And want to make sure that we're not causing severe, long-term, permanent nerve destruction, really. And especially when we're dealing with the fragments of that sciatic nerve that goes into the leg and to the feet, because ultimately diabetes with nerve destruction, it's going to start with your peripheral nerves, peripheral meaning away from spine, and more commonly in the feet, which again is part of that sciatic nerve distribution area. So I definitely want to just touch quickly on nutrition part of sciatica. I don't want to go super in-depth into it because you guys just received an awesome lecture about nutrition from Dr. Roselle and from Sue previously. But some nutritional deficiencies or nutritional supplementation that can be beneficial or detrimental to sciatica included on this list. Starting off with chlorophyll, that can be good for someone who is dealing with sciatica being caused by the ileocecal valve issue. It can line the coating of that valve and of the intestinal tract to help decrease that irritation of the valve. You've got stuff like vitamin A and gonadal support. Those are really good for going back to that conversation of Piriformis Syndrome, if it is gonadal or reproductive organ issue in nature. it can definitely help with providing more strength and vitality to that piriformis muscle if it is reproductive in nature. You got stuff like manganese, protein, and magnesium that can help with the ligament integrity issue. So if you've got ligaments that aren't strong enough, you got the instability of the ligament tissue. Those three things can be supplemented, or they can be supplemented to help regain the strength in the ligaments, or they could have been deficient to begin with, which led rise to the instability of those ligaments. B12 is another great one for the muscle, or I'm sorry, the neurological deterioration. So if you've got any kind of nerve damage, B12 can also often be used to help upregulate nervous tissue. If any part of that sciatic nerve was damaged, giving rise to sciatica. So this is quite possibly always my favorite part of any lecture that I give is the treatments that we do, because ultimately I'm a chiropractor and I got into this because I want to be able to help people. And this is always the part where we get to talk about how do we fix whatever it is that we are talking about, and today being sciatica. So obviously I'm a chiropractor, so my main mode of treatment is the chiropractic adjustment. And we talk about manual manipulations. That is where we've got the hands on you and we are adjusting the neck or adjusting the low back. That's your typical bread and butter of chiropractic. And then we talk about low force corrections. Low force can be, respiratory adjustment. It can be using that arthrostim. So for those of you who've already been in the office, you've seen that little machine gun, little click thing that sometimes we'll use. That's considered as low force corrections, which can be really good for the ligament instability, because you wouldn't want to put in a high force something into a bone that's already unstable. And that's where the blocking comes into play. So we talk about pelvic blocking. We call them blocks, but they look like wedges, really. And we place them underneath the patient's pelvis because we allow gravity to do the adjustment, make the correction for us. Because again, if those ligaments are unstable, and previously you saw how many ligaments are in that hip and pelvis area, and if those are unstable, you wouldn't want to put a huge manual force into those, because you can make those ligaments even more unstable. So instead, we can use the pelvic blocking by putting them underneath that pelvis and allow gravity to do all the work for us. So that way we're still getting the correction, we're still getting the bones back in position like what we need to, but we didn't use the giant force to do it, which allows us to still respect those ligaments as we're still trying to build up the integrity of those ligamentous tissues. I use this photo here because I was trying to find a good picture of a chiropractic adjustment for sciatica, if you will. And in turn, I actually found this photo, and this is actually a check or a challenge or an evaluation, if you will, for someone's sacrum, which is that triangular bone at the base of the spine that we have been talking about. So basically, the practitioner, or me, or whoever is working with you, puts their hand on that sacrum, basically kind of locking it down a little bit, and then having the patient raise each leg up in the air, as you see there. And if someone has got a subluxation or a misalignment within that sacrum, you'll see that one leg will actually go up higher than the other. And so the issue is, if that leg goes up higher, it actually tells us that that is the side that has the sacral issue, because that means that's the side that the sacrum has moved to, which allows for more movement on that side. Again, causing because of that ligament instability. Whereas on the other side, where the leg does not raise up as higher, that means that the sacrum is not to that side, so that ligament is already being overly stretched, which gives less motion, less mobility on that side, and that's why the leg doesn't go up higher. So I thought that was a really cool picture to demonstrate one of the things that I use, at least with my patients, to evaluate the sacrum, because as we saw, the sacrum makes up 3/5 of the sciatic nerve. So I thought that one was a cool picture. And then obviously we can use acupuncture. We did talk briefly at the beginning about the importance of acupuncture. You want to make sure that different organ systems are working together in harmony. Acupuncture could also potentially include, dry needling if we do have any trigger points, again, within, that piriformis muscle or any other muscles that could be involved. Nutrition, we did just talk about the different nutritional components that could be used to help with sciatica, and also we talk about the ileocecal valve being affected by foods that are sensitive to you and that are causing irritation to that valve. So we want to make sure that you're getting proper nutrition to help combat that inflammation and degeneration of that sciatic nerve. Orthotics can be used. We did talk briefly about subluxations in the foot. If you've got your feet that have bones that are constantly being subluxated and misaligned, and some of the ligaments in the feet aren't stable enough, it could be beneficial to use orthotics to provide better structure to the feet, which in turn just gives better structure to anything upstream within the body and turn into that hip and pelvis where the sciatic nerve resides. Ergonomic coaching. We talked a lot about the proper ergonomics versus, having it in the office space versus at home. Obviously, working slouched down in your bed as soon as you turn on the lights when you wake up in the morning is not going to make your sciatic nerve very happy. So sometimes we do have to do some ergonomic coaching with our patients to make sure that their hip, pelvis, sacral area is properly aligned to make sure that that sciatic nerve is nice and healthy. And then lastly, I've made the joke in here of take out your wallet. We did touch base at one point about people sitting on their wallets causing that sciatic pain. Nowadays, it's not that big of a deal, but if you're still one of the few out there that sits on your wallet while you're in the car, you get in your car and you drive and you forget to take your wallet out, take your wallet out, please. It's one of the easy things we can do to help fix sciatica if that's truly what the issue is. Just take out your wallet, put it in your center console or cup holder or something, or you can do like what I do and convert your phone into a wallet so it's 2-in-1, so that way you don't even have a wallet. But it's one of the easiest ways to help fix sciatica if that's truly where the sciatica pain is coming from. Just take out your wallet.